for the Health Development established 27 years ago, and during this period we initiated successful cooperation with the foreign and domestic organizations. Our contribution to development health sector is directly linked with organizations we work with the common goals. Our cooperation with the JAYKA started in 2011 when Center was the government implementing agency. At that time, Dr. Inkpat, who was the head of the agency, and Mr. Isagai Tashinori, who was the head of the JAYKA representative office in Mongolia, signed memorandum of cooperation, and since then collaboration expanding and progressing successfully till today. At first, actual collaboration started with Japanese volunteer workers come Mongolia and worked with their colleagues. Today, JAYKA Health Project team has been established and located in our center. The project has great contribution to improvement of our postgraduate training doctors, nurses, and midwives. In 2015, the project to improve postgraduate training of the primary and secondary hospital doctors started and implemented successfully. During the project unit, the Ministry of Health and Center for Health and project unit were focused on the guiding the model provinces. Bulgan Orhan General Hospital and regional diagnostic centers was involved in to implementing project. During the project implementation period, we done the following activities. Advanced assessment for life support training was organized for the emergency room doctors. The training was organized 36 times within the framework of the guidelines which approved the director of the Center for Health Development. The program curriculum adopted by Japanese ASC program. 337 doctors participated in these trainings. For the second, pediatric basic life support training was organized to learn techniques of cardiopulmonary resuscitation without special equipment and tools. This training was organized 16 times. In total of 156 emergency medicine doctors participated actively. When the organizers compared the test results before and after the training, the knowledge of the doctors was improved by the 30 to 40%, which indicates the training was very effective. The next one is in order to improve the knowledge of medical staff about the infection prevention and control, we provided special training for this topic. Also, the National Center for Communicable Disease conducted online training course on prevention and control new types of the coronavirus infection medical facilities. The project framework ethical questionnaire survey conducted to evaluate medical staff in customers' current situation. Based on the needs of the training, we developed the contents of the training program, which contains basic 5 ethical principles. And JAYKA Center for Health Development and the Mongolian Nurses Association jointly organized training on ethics and attitudes of medical professionals. This training was organized including with the district hospitals, central hospitals, and other subspecialty hospitals. More than 300 medical staff participated in the training. For the TOT facilitators preparation part, we adopted the good practice from Japan and developed guidance for organizing courses in 2020. The course was mainly focused on the improving teachers' skills for the teaching and running courses. The total in 2021, 4 trainings organized and 96 teachers prepared for the future trainings. In 2022 TOT training was organized 7 times and 168 doctors participated. Also, facilitator course organized doctors received their facilitator's certificate. For the nursing part, we organized some trainings, and also 2022 we organized 5 trainings for the midwife and nurses. As of today, we already trained 144 nurses and midwives for the future teachings. In addition to all these trainings, we also developed jointly the criteria for evaluating and also developed the sample for writing reports. Those documents approved by the director of the Center for Health Development. The special course organized to evaluate the progress of conducting postgraduate trainings and trained 5 professionals. The proposals for their eligibility criteria postgraduate training institute selection are included annexed in the main evaluation. Also, progress evaluation criteria developed and using them for the health institutions evaluation now. Since 2018, 1-year rotation program for general practitioners training has been developed, and the special manual for the 4 main subspecialty rotation is published. Currently, 53 residents are studying. We also worked on the promotion and awareness of the general practitioner. Since 2021, the project modified as improving postgraduate training for medical professionals and nurses. The second part of the project will be continued till the end of 2024. The project will be implemented the following activities. Those are to improve and strengthen the nurse education system. Currently, we are working on the nurse and midwife training curriculum, clinical ladder program, career advancement program, competency, improvement of the hands-on skills, fellowship program, support professional association and societies, and develop facilitator program. Working group organized by the order of the Director of Center for Health Development and organized online discussion in last October. In 2022 November, working group organized face-to-face meeting for further advancement of the planned work. For the improving midwife education system, working group established by the Ministry of Health to develop TOT training program, organized trainings, and develop curriculum for postgraduate training of the midwives. 10 professionals visited to different hospitals to improve their knowledge and get the experience from Japanese colleagues in Japan. Regional Diagnostic and Treatment Center of Talarhалын organized general practitioner training and experience sharing seminar in Erden City. Total of 26 directors, head of the Human Resource Department, and doctors participated from the 14 health institutions to gather information and experience sharing. Since 2018, 38 doctors and health professionals attended in seminar and courses in Japan to improve their knowledge and skills. In 2022, 24 doctors and medical staff participated in training in Japan. JAYKA consultants organized the capacity building 2-day seminar in January 25th and 26th of 2023. The seminar was focused on to update the content of the curriculum in line with the new international methods. This year, we also organized trainings using the new TOT programs which approved in February 2022. Now we would like to introduce the activities we organized in the Center for the Health Development. In 2018, we implemented a short-term project which focused on improving our work efficiency. Within that project, survey conducted, our employees had interviews, and we developed preliminary report. Based on the report, we organized 7 different trainings. Those are 5 Whys, implementing 5 As, 7 items of quality development to develop work plan. These trainings had advantage that based on our real needs in assessment. Project lasted 1 whole year. All our center staff identified retraining needs and learned many methods to use in the future. This project cooperation has great impact on the skills of our employees. On the behalf of the Mongolian health sector, we would like to express our greatest gratitude to JAYKA, all our project leaders, team members who have contributed to improvement of our healthcare services in Mongolia through this project. We believe and confident that our 2 organizations' cooperation will continue and develop more in the coming years. Thank you.